The 12 cancer red flags you can't afford to miss. Wait until it's too late. Did you know catching cancer early can boost your chances of survival by as much as 90%? Once. That's no exaggeration. Early detection truly saves lives. But here's the catch. Too many folks miss the early warning signs because they seem small or easy to brush off. Those little changes in your body, maybe something you'd normally ignore, could actually be your body waving a red flag. And I've seen it too many times in my years as a doctor. Waiting too long can make all the difference. So today I want to walk you through 12 silent yet powerful warning signs that might signal cancer. Some may surprise you, but knowing them could give you or someone you love the chance to act early and possibly save a life. This is Science of Wellness, where we believe that one moment of awareness can change the course of your health. If you're ready to take that first step, go ahead and tap like here and hit subscribe. We've got more life-saving info coming your way. Alright, let's dive into these signs. It's too important to ignore. Number 1. Unexplained fevers or night sweats. Sure, we all get a fever now and then, usually from a cold or some kind of bug. But if you're running a temperature that just won't quit, and there's no clear reason for it, that's something to take seriously. In cancers like leukemia or lymphoma, your immune system can go into overdrive, creating a kind of internal firestorm that causes recurring fevers. And let's talk about night sweats. If you're waking up soaked, even though the room's cool and you're not bundled up, that could be your body trying to tell you something's wrong. These symptoms might seem vague, but when they happen often and without an obvious cause, it's time to check in with your doctor. Don't brush it off. Early action could make all the difference. Number 2. Lumps or thickening under the skin. Now listen, not every lump you feel is cancer, but some are, and they often sneak in quietly. The ones you want to watch out for, they're usually firm, don't hurt, and seem to stick around, or even grow over time. In cancers like breast cancer or lymphoma, these lumps might not move much under the skin, and that's a red flag. If you find something new, a lump, a thick patch of skin, or anything that just doesn't feel right, and it doesn't go away after a few weeks, don't wait it out. Get it checked. Your doctor may want to run a few tests to see what's really going on. It might be nothing, but if it's something, early detection can change everything. Number 3. Skin changes. Not all skin changes are harmless, and some can be downright dangerous. Melanoma, a serious form of skin cancer, often starts with something that looks small, but can grow fast if left untreated. Here's what you want to remember. The ABCD rule. A is for asymmetry. One half of the mole doesn't match the other. B is for irregular borders. C stands for color. If you see more than one shade, brown, black, red, even blue, take note. And D is diameter. Anything bigger than a pencil eraser should be checked. Whether it's a new mole or changes in an old one, don't take chances. A quick visit to a dermatologist could give you peace of mind, or catch something early when it's most treatable. Number 4. Changes in appetite. Losing your appetite might not seem like a big deal at first, but when it happens for no clear reason and sticks around, it could be your body's way of waving a red flag. Cancers that affect the digestive system, like stomach or pancreatic cancer, can mess with how your body controls hunger. Tumors sometimes release substances called cytokines, which can interfere with the part of your brain that regulates appetite. The result? Food just doesn't sound good anymore. This can lead to unintentional weight loss, low energy, and even malnutrition, making it harder for your body to fight back. So if you're eating less and not sure why, especially if it's out of character for you, don't ignore it. Talk to your doctor. It could be more than just stress or a busy week. Number 5. Difficulty swallowing. If swallowing has started to feel like a chore, or worse, if it's painful or you feel like food keeps getting stuck, don't brush it off. That kind of ongoing trouble, called dysphagia, can be more than just annoying. Sometimes, cancers of the throat or esophagus are to blame. Tumors in these areas can narrow the food passage or irritate nerves involved in swallowing. You might notice choking, coughing while eating, or even avoiding meals, because it just doesn't feel right. It's easy to write this off as acid reflux or aging, but if it sticks around, it deserves a closer look. The sooner you get it checked, the better your chances of catching something early and starting treatment when it matters most. Number 6. Persistent coughing, or hoarseness. We all get a cough now and then, but if it lingers for weeks, or starts getting worse instead of better, it's time to pay attention. A chronic cough could be your body's way of signaling something deeper, like lung or throat cancer. Lung tumors can irritate your airways, triggering a dry, nagging cough that just won't quit. And if cancer affects your vocal cords, it can make your voice sound hoarse, raspy, or strained, even if you haven't been shouting or sick. Now here's the serious part. If your cough brings up blood or is paired with unexplained weight loss, don't wait. These are warning signs that need to be checked out right away. Early detection gives you more treatment options and better outcomes. Stay with me, because the next 6 signs are crucial, and trust me, they'll surprise you. Number 7. Unusual bleeding or discharge. Seeing blood where it doesn't belong is never something to ignore. Whether it's in your stool, urine, or even when you cough, it could be your body trying to alert you to something serious. For example, blood in the stool might be a sign of colorectal cancer. Blood in the urine, what we call hematuria, can point to issues with the bladder or kidneys. And coughing up blood could be linked to lung cancer. What's happening here is that tumors sometimes damage nearby blood vessels, causing bleeding that shows up in these ways. It might feel awkward or easy to dismiss, but any unexplained bleeding deserves immediate medical attention. It's better to check it out and catch something early than to wait and wish you had. Number 8. Persistent indigestion, or stomach discomfort. We've all had indigestion from time to time, maybe after a big meal or something spicy. But if you're dealing with ongoing heartburn, acid reflux, or that uncomfortable bloated feeling that just won't quit, don't shrug it off. Chronic stomach issues like these could point to something more serious, such as stomach or esophageal cancer. Tumors in these areas can block or irritate parts of your digestive system, leading to recurring pain or discomfort that doesn't go away with the usual antacids. If you've tried the over-the-counter stuff and you're still struggling, it's time to talk to your doctor. Catching the problem early gives you more options and a better shot at staying healthy. Number 9. Persistent fatigue. We all get tired, but if you're feeling completely drained day after day, even after a full night's sleep, it could be more than just a busy schedule or stress. Fatigue that doesn't go away, what we call persistent fatigue, can be one of the earliest warning signs of cancer. That's because cancer cells use up a lot of your body's energy, leaving you feeling wiped out for no obvious reason. Some cancers, like leukemia, can also cause anemia, which only makes the exhaustion worse. If you're constantly running on empty and rest isn't helping, don't just push through it. Talk to your doctor. Your body might be trying to tell you something important. Number 10. Persistent pain, or discomfort pain, is your body's way of signaling that something's wrong. And while most aches and pains go away on their own, any pain that sticks around or doesn't have a clear cause should be taken seriously. Cancer can cause pain, especially in its early stages, as tumors press on nearby nerves, muscles, or organs. You might notice localized pain in areas like the bones, ovaries, or testicles, which can be linked to certain cancers. If the pain doesn't go away or doesn't seem to make sense, don't wait to get it checked out. Persistent pain is often one of the first signs that something more serious might be at play. Number 11. Changes in bowel or bladder habits. If you notice that your bathroom habits are changing, whether it's frequent constipation, diarrhea, blood in your stool, or needing to urinate more often, don't ignore it. These could be warning signs of colorectal or bladder cancer. Tumors in these areas can cause blockages or inflammation, throwing off your digestive and urinary systems. While these symptoms can sometimes be linked to less serious issues, they're also often one of the first signs of cancer. The earlier you seek help, the better your chances of effective treatment. Number 12. Unexplained weight loss, losing weight without trying. No change in diet or exercise should always be a warning sign. It's especially common in cancers of the stomach, pancreas, and esophagus, where the tumor interferes with your body's ability to absorb nutrients or causes rapid weight loss due to its aggressive nature. In fact, research shows that up to 40% of cancer patients experience unexplained weight loss before they're even diagnosed. So if you're dropping pounds for no reason, don't wait to see your doctor. Early intervention can make a big difference. Your body is always sending you signals. And these 12 warning signs are messages you can't afford to ignore. They're subtle, but they could be the key to early detection, which is so important when it comes to cancer. The sooner we spot these signs, the sooner we can take action, and that can make all the difference in treatment and recovery. Awareness is your best ally in the fight against cancer. By staying alert and proactive, you give yourself the best chance for early intervention, which is often the most effective. Don't take your health for granted. Stay informed and stay on top of any changes in your body. I really hope you found this information helpful. If you did, please give it a thumbs up and subscribe. Your support truly motivates me to keep bringing you more valuable content to help you live a healthier life.